Anyone who's experienced anti-anxiety medication, antidepressants, antipsychotics, prescription painkillers, or general anesthetic knows that these drugs are mind-altering by nature, and some are extremely intoxicating. However, most Muslims don't consider these medications haram for a pretty good reason. They are prescribed by a medical professional for medical use. Allah tells us no less than 4 times in the Quran that we can even eat pork if we are starving and have a cleared need. So really, the haram or halal character of something like OxyContin or Xanax has more to do with the circumstances and intention of its use than the substance itself. If it's prescribed by your doctor for a legit reason, it's seen in a very different light than if it's taken recreationally to get high. Makes sense, right? Well, it didn't get much attention, but in 2014, a fatwa was issued by the Grand Ayatollah Rohani specifically designating psychedelic medicines as permissible if they're used under supervision and care of a qualified professional. What's fascinating about a drug like LSD is that for the first 20 years of its existence, this is mainly how it was used, under the care of professionals in psychiatric clinical settings. LSD, or lysergic acid diethylamide, was first synthesized in 1938 by Swiss chemist Albert Hofmann at Sandoz Laboratories, but it wasn't until April 19, 1943, that its powerful psychoactive properties were discovered, by accident no less, when Hofmann himself ingested what he thought was a minuscule amount, 250 micrograms, and experienced its effects firsthand as he rode his bicycle home. Recognizing the healing potential of this novel compound, Sandoz began producing LSD under the brand name Delicid, distributing it to researchers and psychiatrists around the world. This was the beginning of LSD's journey into the world of psychiatry. During the 1950s, LSD gained significant attention within the psychiatric community as a possible treatment for a variety of mental health conditions. Researchers began exploring its use in treating alcoholism, depression, anxiety, and other disorders. One of the key figures in this period was Dr. Humphrey Osmond, a psychiatrist who coined the term psychedelic. Osmond conducted groundbreaking studies on LSD as a treatment for alcoholism with remarkably high success rates. This was highly significant at a time when few effective treatments for alcoholism existed. Osmond's work laid the foundation for what would become known as psychedelic therapy. But LSD's potential wasn't limited to treating alcoholism. The 1950s and 60s saw a surge in its use within psychedelic psychotherapy, a method developed by psychiatrists like Dr. Sidney Cohen. This approach typically involved multiple LSD sessions at varying doses integrated with traditional talk therapy. The goal was to facilitate deep psychological insights and emotional breakthroughs, often with astonishing results. Patients suffering from depression found relief, those with anxiety were able to confront their fears, and even individuals with obsessive-compulsive disorder reported positive outcomes. Hollywood's elite even turned to LSD as a tool for self-discovery and therapeutic healing. Cary Grant, one of the most iconic actors of his time, is perhaps the most famous example of a celebrity who used LSD under clinical supervision. Grant participated in over 100 LSD therapy sessions during the late 1950s and early 60s. He credited these sessions with helping him overcome deep-seated personal issues and achieving a greater sense of self-understanding and happiness. Grant was so impressed with the results that he publicly praised LSD therapy, helping to bring attention to its potential benefits at a time when it was still legal and widely studied. Another legendary actor, Jack Nicholson, also underwent LSD therapy, and Nicholson has also spoken publicly about his experience with the drug, describing how it was used under supervision with the intent of exploring his psyche, helping to process his divorce, and more. For Nicholson, LSD was a tool to massively increase the effectiveness of clinical psychotherapy. But the story of LSD was not to remain in the quiet halls of psychiatric offices. By the mid-1960s, LSD had escaped the confines of the clinic and entered the broader cultural zeitgeist. Figures like Dr. Timothy Leary, who initially approached LSD from a clinical and research perspective, became advocates for its use in a much broader context. Leary's famous phrase, "turn on, tune in, drop out," became a rallying cry for the countercultural movement. LSD was now becoming a symbol of rebellion, a tool for spiritual exploration, and a gateway to higher consciousness. As LSD's popularity grew, so did public concern over its widespread, unsupervised use. In 1968, LSD was classified as a Schedule I drug in the United States, severely restricting its availability for research and medical use. The substance was demonized in the media, and its therapeutic potential was largely forgotten by the mainstream medical community. And so, by the time LSD began to confront the Muslim world, it had already been illegalized and was firmly associated with the counterculture and the concept of getting high. This is a little ironic considering that for the first 2 decades of its existence, LSD was almost exclusively used in clinical psychiatric settings. Nevertheless, this presentation of LSD not as medicine but as a drug undoubtedly set it up to be denounced as a haram intoxicant within Islamic legal frameworks. However, as stated earlier, it's not the mind-altering nature of a substance that usually makes it haram, it's the context in which it's used. But this brings us to a pivotal moment in our story. In March 2014, a significant development occurred within the world of Islam. Grand Ayatollah Sayyid Muhammad Sadiq Husseini Rohani issued a fatwa that would resonate throughout the Shia community and beyond. This fatwa stated that entheogenic drugs, substances that can induce altered states of consciousness such as LSD, are permissible under traditional Islamic law, provided they are used under the observation of a trained specialist. This ruling means essentially that in therapeutic settings, where these substances are used under expert supervision for healing purposes, their use is not considered sinful or forbidden. This fatwa has significant implications for Shia Muslims especially, who make up a substantial minority of the global Muslim population, with millions living in countries like Iran, Iraq, Pakistan, and India. The decision was the result of a dialogue between Islamic scholars and the Shia ecclesiastical establishment, with input from both religious and scientific perspectives. The fatwa did not explicitly list which specific psychedelics are permissible, but mentioned discussions around substances like ayahuasca, DMT, psilocybin, and ibogaine. This all constitutes a notable contribution to the global conversation on entheogens and religious freedom. It reflects a nuanced approach to the use of psychedelics, acknowledging their potential therapeutic benefits when used responsibly and under proper guidance. It's critically important that whatever our stance on clinical use of psychedelics might be, we have to start from the understanding that global mental health crises are getting worse, not better, and we desperately need more effective treatments. As more data from research studies becomes available, and as public perception shifts, there is potential for LSD to be integrated into a new wave of psychedelic-assisted therapies. Based on the 2014 fatwa, it's clear that a bunch of hippies tripping on acid for fun would not be condoned as permissible under Islamic law. However, LSD used in a strictly clinical setting under professional care for the treatment of treatment-resistant conditions could be. And this could mean that if LSD is decriminalized, a halal psychedelic renaissance could be on its way. In a world where ancient traditions meet modern medicine, the story of Islam and LSD is still unfolding. With the right conditions and responsible use, we may soon enter an era where LSD, once again, serves as a tool for healing, just like it did for the first 20 years of its existence. So, are thousands of Muslims on the verge of taking LSD for the first time? It's increasingly plausible that we will see just such a development in our lifetime.